Hi there, it's Martha Monroe here, and we are joined by expert pelvic health physiotherapist Amanda Gemmell. She's an amazing local pelvic health physio who's located in Kingsville, Ontario. And I invited her here as a big advocate myself for pelvic health physio and somebody who has been helped personally by pelvic health physio. I feel like, every second consult I do, I'm referring people to pelvic health physio. So I invited her here today to just kind of give you the rundown of what pelvic health physios do, what's it all about, who she helps, who pelvic physios help, and what you can expect if you decide to go that route. So welcome. Thank you so much for being here, Amanda.
Thank you for having me.
That's awesome. So I'd like you to start, if you don't mind, with sort of introducing the idea of who you help in your practice and how it is that you help them.
Okay, so I am a physiotherapist, so I do see people for things like, sprained ankles and knees and shoulders and things like that. But then I also focus a lot of my practice on pelvic health. So that way I can help people who help men and women, but all the way from urinary incontinence or urinary leakage to pelvic pain. Things like constipation or diastasis recti, scar mobilization techniques, chronic low back or hip pain, things like that.
That's great. And so how do you help them?
So with pelvic health, so typically an exam will be, so we start with a really detailed history. There's quite a bit of paperwork that gets sent out beforehand, and that allows us to know, okay, what do we need to focus on? And then we build a really strong foundation through there. An exam will include like a full orthopedic exam. So we still look at the low back, we still look at the hips, things like that, just to make sure we don't miss anything. And then the pelvic health exam itself usually includes an internal exam. So typically vaginal and rectal. And with an exam like that, we're able to assess all the muscles on the inside of the pelvic floor. So those muscles, just like any other muscle, we're going to look at the strength, the endurance, the agility, the coordination, and is the dysfunction coming from one of the pelvic floor or many of the pelvic floor muscles, giving individuals these issues. So then, based on what we find, give tons of education and then a home exercise program so that you can work on it at home, and then build towards getting or solving the dysfunction.
That's great. I think so commonly, and I'm sure that, you see this too, so many people feel like, if they're leaking or they're having pain, that it's just kind of like, it is what it is. But there is help for those issues if that's something that you want to, see some change with. And I think like I typically, like any client that I have who's pregnant or postpartum, it's like, we don't know what's going on until we check under the hood, right? And that's not something that, your personal trainer or even, your doctor, your gynecologist who's doing a pelvic exam, they may not understand the musculature to the extent that the specialized training of a pelvic health physio does. And it's just, if you can get your care team all working together, it can be really supportive to the like whole person.
And I think you just hit the nail on the head with looking at different experts and what they do. So gynecologists, they are, they're looking at typically like diseases, and they're looking at or just pathways and things like that. They're not really looking at muscles, and they're not looking at function. So even having an internal exam by a gynecologist, they're just not looking at the same things that we're looking for, which is normal and totally fine, but we want to make sure that we address the muscles because they can cause us a lot of issues.
Absolutely. And I always think for like postnatal clients that it's like, if you had had a surgery or a major event happen anywhere else in your body, like whether you end up with a vaginal delivery or a C-section, if you had had a surgery anywhere else, going through physio would be part of that normal recovery process. But I think for a lot of people, because they're like, oh, it's my vagina, or it's like a C-section, that like maybe I don't need that. And so I think that it's, yeah, it can be really helpful to get like the big picture of what even is going on, and like if there are any issues that are there, and just to support that like optimal function and optimal healing process is like, yeah, super, super helpful. Awesome.
Yes.
So for somebody who is maybe a little bit nervous to go and seek a treatment like this, how would you explain to them sort of what to expect?
So as far as being nervous, and I find that most people hearing the internal exam, that's what makes them very nervous. So I start with tons of education showing, okay, this is the function. What do the pelvic floor muscles actually do? And how might that relate to your symptoms? But also keeping in mind that you don't have to have the internal exam. That's not something where like, okay, you've come to this exam, so we're going to do an internal. That's completely up to every individual. So if someone decides to opt out of the internal exam, what we do is do a lot of verbal cueing and still a ton of education, because there can be some trends that we see with certain symptoms. So I feel like that's usually something that makes people quite nervous to come in, but I think just getting an assessment and seeing what's going on and not being fearful of it, because our whole goal is to make or to allow you to do things and not say, okay, well, you can't do this anymore. That's really we want you to be able to get back to everything that you want to be able to do in a safe way, and in a way that you're not scared to work out, for example.
Yeah, I think that's great. I think that focus on empowering, and of course, like you said, like it's consent, it's what you choose that you want. And just from my personal experience, less uncomfortable than a pap test. So
Yeah. And that is something, as far as pelvic health goes, is especially if someone's had a very uncomfortable pap exam, that's what they might relate us to. But unlike a pap exam, if it was very uncomfortable, we don't push past pain, pelvic health physios, because the body will remember. And it's almost like if you've ever had a ball or something thrown close to your face, right? We kind of do one of those. Yes, exactly. So then if we say we did push past pain to do the assessment, every time you'd walk into the room, those pelvic floor muscles would tighten back up, and then we really wouldn't get anywhere. So if there is any discomfort during the exam, if there is any pain, we actually stop there and we work through that and find out different ways. Okay, how can we get rid of this pain? How can we reduce it? And then you use those techniques going forward into other areas that you might have pain with.
that's great. That's awesome. I think I love that approach. So what are some of the common fears? So with clients who are, say, wanting to exercise or be more active, but they feel like they can't because of pelvic floor issues or dysfunction, how would you address that with clients?
So that things like, I think that there's maybe a lot of misinformation out there, a lot of yeah, just a lot of things that are told to people. So, after you have kids, like it's normal that, you leak a little bit when you do jumping jacks or when you laugh too hard. That's kind of just the way it is, which is really not true at all. That's a very common misconception, or that, urgency that, yep, after having kids or while pregnant, like, yep, that's totally normal, not being able to make it to the washroom. So as far as kind of just education about what's normal and what's not normal, and then what we can do about that. And changing habits that way. So really, so much of what I do is actually just teaching little tips and tricks. Like, for example, we don't want to do just in case pees. And that's because you can empty the bladder before it's actually full. And if you always empty the bladder before it's full, then it doesn't stretch as much. And then all of the sensors at the top there, when the bladder's filling, because it's always collecting, they become really, really sensitive. So then if you do hold your urine a little bit longer than normal, then that's when you can get in that urgency. I can't hold it anymore. So even something as simple as, okay, let's really stop doing just in case pees, and just little tips and tricks along there.
That's great. I think that like with the internet, there's so much information that's out there that it can be really overwhelming. Like I always see, like, with diastasis recti and pelvic organ prolapse, which are very, very common, that, like, okay, now you can never do squats again, and you should never do crunching movements, and you should, there's a lot of, it can feel like there's a lot of rules. But I mean, I think that those guidelines can be helpful in, like, say, like a group class. But when you bring it to an individual level, that I think that, like, with the right support from pelvic health physios like yourself, and like trainers who understand postpartum, and a full team of support, it's like you can do the things that you want to do, and that it there doesn't have to be this, like, big disempowering fear of, like, oh, now you can just, oh, you had a baby, you can never run again.
Right, right. And even I've heard just, along the way, like, oh, well, I've tried Kegels before and like that doesn't work. Where really Kegels are not one size fits all. I do not give Kegels or pelvic floor contractions to everybody, because sometimes, and a lot of the time, I find people aren't really truly weak. It's that maybe they are uncoordinated, so the muscles don't know when to turn on, or maybe they're turning on way too hard and everything's contracting really hard when you go to do something and you're overcompensating. So really just learning, okay, are things too tight? Because if things are tight, that doesn't mean you're strong. Or are things uncoordinated and they just don't know when? Or are things actually truly weak and we need to work through that? So yeah, Kegels are not one size fits all. And then really moving that into something functional, because lying and doing Kegels on a bed or sitting, like, it's really good to be able to do, but what about when we go to lift something heavy? So we need to be able to coordinate that, because we have to lift things all day, every day, forever.
Absolutely, yeah.
Yeah,
It's
so
a
and
little
lifting,
functional.
yes, yes, and lifting is an exercise. Heavy lifting, all that's actually good for our pelvic floor. That's something I hear a lot, was like, oh, I'm told I'm not allowed to lift more than 20 pounds ever, and that's really, really not true.
It's
Lifting
like,
is,
well, real life is going to require that, so
yes,
let's
real life,
be
especially if
stronger.
you just have if you just had a baby, right? Well, babies pass 20 pounds pretty quickly, and we have to be able to lift them. So learning how to strengthen those muscles, because if we train harder than we ever have to practice in real life, everything will be easy.
Yeah, totally. I always talk about that with clients. It's like, well, you want to have strength in reserve, right? If you're strong enough to lift, like, 150 pounds, carrying in your groceries will not be a strain on you, or carrying your kid, right? So, if you have strength in reserve, everything else is easier. And I think that yeah, that transfers across the board. That's awesome.
Mhm.
So anything else that you wanted to share with the audience here, Amanda?
I just wanted to bring up a little bit, maybe about even the connection between low back pain and a pelvic floor dysfunction,
Absolutely.
because that's actually what got me into pelvic health. I got into pelvic health about 6 months into my career, and I was coming across a few patients who really, we were doing everything under the sun, and I knew they were doing their stuff, and we still weren't able to really change their low back pain, like in a significant way, and make it permanent. And that's the whole goal, is to make it so you can treat yourself. You don't have to see me anymore, or if you have another injury or have something else go on. So with low back pain, there is incredible research behind the connection between low back pain and pelvic floor dysfunctions. So if you do have the low back pain that you've tried all these different avenues and it's still nagging and not really quite going away, and you do experience things like pelvic pain, which could include pain with intercourse, or painful periods, or things like that, or if you have a prolapse or experiencing a little bit of urinary leakage when you cough too hard, or anything, or constipation, anything in that area, then you might actually be chasing symptoms, and that's why nothing really seems to be permanent.
Yeah, I think that that's awesome. And I think for me, when I'm talking with clients, it's kind of like, you know, our pelvic floor is like, you know, it's the canister, right? It's your core. I mean, everybody's kind of very aware of like, oh, I got to strengthen my core. I got to strengthen my core. You know, particularly when people have had back pain, they've probably heard, well, then that means you need to strengthen your core. And it's like, well, a part of your core you might need to be, you know, coordinating more. Might not be like, okay, you need to do like Pilates forever and ever. It might be that like we need to figure out what's going on with your pelvic floor and then just get you strong overall. And that will kind of fix the rest of it.
Absolutely. And really, they go hand in hand, right? Like, you know, when
Yeah.
we strengthen our core, the pelvic floor, when functioning properly, it really does go along with it. And, you know, if anyone out there ever had a point where they think, well, you know, years ago I never had this problem. Well, years ago everything was working like it was supposed to be working, and then you didn't even know those muscles were there. And now that if you're having an issue, people tend to, through research or through word of mouth, they start to hear about these different muscles and might not really know how they can play a role. So yeah, if when the muscles are doing everything they're supposed to, we don't even know that they're there.
Yeah, that's awesome. Great. Well, thank you so much for taking the time to do this with us and kind of introduce people to what you do and how you help people. I think that it's, you know, physios like Amanda are a wonderful resource and can really be a transformative experience to your experience in exercise and your experience in everyday life. So thank you so much.
Thank you for having me.